All right. Well, hello, everyone. I'm Mahshid Abir. I'm the Executive Director of the Alliance for Policy Research, which is a recently instituted LLC. We are a group of public policy experts and researchers that have come together to conduct research under a novel business model that will help minimize organizational overhead and also bureaucracy in order to produce timely data and analysis to inform public policy. I am joined today by two of my esteemed colleagues and Alliance for Policy Research members who will be speaking today. I would like to start with Dr. Hamad Al-Ibrahim. Hamad is a very dear colleague and friend, and him and I have been working together for a long time. He is currently a research assistant professor in the policy department at the Social and Economic Survey Research Institute at Qatar University, where he leads innovative research at the intersection of health policy, artificial intelligence, and evidence synthesis. Aside from being a health policy and health services researcher, Hamad just last night got home from Qatar to Boston. And I'm going to turn it over to him because he has agreed to kindly share the experiences that him and his family have had over the past 2 weeks or so in the region. With that, Hamad, I'm going to turn it over to you.
Thank you so much, Mahshid. It's really nice to see all of you here. So the region has been going through this big conflict for the past 10 days. And the region is considered to be one of the most safest regions globally before this event. So Qatar, Dubai, Saudi, we live in a region where we have lots of conflicts around us, but the GCC states, they did not witness any of those conflicts. I don't even remember the last time they went into a war. The Kuwaiti-Iraqi war, which happened late 80s, early 90s, it was limited to only Kuwait. But for us, for the other GCC, to hear missiles over us on a daily basis, sometimes 3-4 times, was really traumatic to all of us. So we went through 2 phases. The first phase where we had the radars functioning, we would receive notification only when missiles were close to Qatar through mobile alerts. But then when the Iranian, they struck the radars, we started to receive alerts when the missiles are very close to us. And the alerts were very, very traumatic, to be honest. So you receive an alert at 2 a.m. that this is a, what do they call it? It's like an alert with a high threat or something. So you rush downstairs with your family. You try to shelter in a room which you think is the safest room in the house. And this happened frequently in the past since the war starts. So twice or 3 times a day, 2 a.m., 4 a.m., 6 p.m., 11 p.m., so randomly, you cannot even predict when it's going to happen next. And you don't know whether you're nearby or far away from the missiles. Qatar geographically is a very small country. So any missile, even if it went to the American base, we still hear the blast sound. So this is one. Second, Qatar has Qatar Airways. I think most of you experience Qatar Airways either through traveling directly to Doha or transiting through Doha. We couldn't fly. We couldn't use Qatar Airways. The only way to leave the country was through transporting through land via Saudi. And then even the nearest airport to Doha, which was at Dammam, which is 4 hours driving, was being hit by the Iranian missiles. So they had to shut down the airport. So the closest airport was Riyadh. which is like 7 hours driving from Doha through the desert to reach Riyadh. And then from there, you can transit to somewhere else. The initial reaction of the State Department was very awful, to be honest. They didn't know whether they had to evacuate a citizen from those countries or not. But recently, they had task force, and the task force will call different families, and they will make sure that you get a charter to somewhere safe, not to the US. The charter planes are very different than commercial planes. They are smaller. So they will be evacuating American families to somewhere safe, like Athens. I heard Spain and what have you. But you always had the commercial option. I'm going to conclude by saying I am quantitative analyst by training. So I was trying to calculate the probability of being safe, staying in shelter in Doha, or taking the risk of adding those probabilities by driving to Saudi. And then we calculated that probably our chances to do the long trip to Riyadh, and then from there to Istanbul, and then from Istanbul to Boston. I'm glad we are all safe. People are safe, so we didn't have any death in Qatar. Unfortunately, other parts of the Gulf state, they had few death incidents from the strikes. But in Qatar, it was mainly some injuries, minor injuries. The defense system is very good. I really miss how safe the region was. And let me stop there. Thank you so much.
Thank you, Hamad. I would love if you can speak to perhaps any information you have from the time that you spent in Qatar about access to healthcare services, and whether or not people are facing barriers, if there are access and capacity issues. As you know, and others on this call may know, you and I worked on a project during the pandemic, at the height of the pandemic, where we studied the public health and healthcare response to COVID in 5 Middle East nations. And those actually included Qatar and Iran. And in that work, in both countries, we identified significant healthcare access and capacity issues, particularly as it relates to chronic disease management and mental health issues and access to those during the pandemic. So I would love to hear if what you were seeing on the ground as far as that's concerned.
So I think the ecosystem of health services in the region was really prepared by the COVID pandemic, believe it or not. So they invested so much in telehealth during the COVID period, which made the system ready for any emergency, similar to COVID. And it felt, to be honest, it felt like COVID, beside the the sound of the missiles. It felt like COVID. We were isolated. We were not allowed to leave. And even working during this period was working remotely initially. So 100%, all the staff in all sectors except for the defense, military, police, and health, they were supposed to be working from their work physically, but all the remaining workforce, we were ordered to work from home. And then when we had some control, they started to say, okay, 30% are supposed to work physically, 70% will work remotely. It's the nature of your job does not necessitate that you be there physically. The health system was really prepared. I'm going to commend what they've been doing during this period. We had access to medications. We didn't need to go to the hospital to collect medications. We called the physician through telehealth, and then they will prescribe medications if needed. I didn't see any barrier, to be honest, during that phase. I think the only concern, which I did not experience, if someone was going through an emergency surgery and it will take a few hours and then you receive such siren or warning on your phone, how are you going to react? This is one aspect. The second aspect, so my wife, she's a physician and she's supposed to be at the hospital. The mental health burden on the physicians, on the people who are there and doing their job, not sheltering. And in the middle of the surgery, she has to run somewhere and she has to shelter till she receives another notification telling her, it's safe now, you can go back to your job. it's a huge burden. It's not being evaluated, it's not being analyzed. Nobody did any kind of study because the data is not being collected. Burden that I felt from a personal experience through my wife is there. Um, so, long story short, the services were good. The um, the pandemic played a major role in making the system semi-ready. The only difference I would say is when you shelter during the siren and then when you go back to do your job.
And also, there's reports coming out of Tehran and also Bahrain about black rain after some oil sites are being hit and bombed. Obviously, there's a concern for inhalation of the air that contains pollutants after such events, particularly for people with cardiovascular and respiratory illness. What did you hear, if anything, on the ground about that?
So we saw from the news what happened in Tehran. I think it was 5 6 days ago, where basically one of the oil refineries were struck by a missile, and then um, there was black smoke for 3 4 days till they were able to contain the fire. That happened in Tehran, but then 2 days ago it happened in Salalah in Oman. Um, and the region is witnessed this during the Iraq-Kuwait war, where basically they put on fire, I think, around 700 refineries for a few months, and they were not able to control it. The Iraqis before they left Kuwait. Um, I didn't notice any. We didn't hear any reports. Again, the data there is a big issue. The data in the region is a big issue. But we saw the black rains in Tehran. We saw, and it was raining in Riyadh and Qatar during that period. And we were saying, okay, are we going to get black rains in this region? And we did not. And I think we were lucky because the wind during that phase was going to the east, pushing all the smoke to Afghanistan and Pakistan rather than bringing the smoke to the region. Um, w- so I think it was very difficult to evaluate the impact of this. I think the biggest threat, I have a number of slides, Mahshid, and let me know whenever you want me to present those slides. The biggest threat that I've been hearing from environmentalists is the oil tanks that exist and parked today in the region. And what's going to happen if the oil leak in the water? we we are still water scarce countries. We in Qatar rely on water desal by 100%. Most of the Gulf countries rely on water resal by around 100%. Saudi the same. And if there is oil leak in the Gulf region and we rely on water desal, how is this gonna help the situation? I think we have a water supply of 4 days. Saudi has a water supply of 7 days. This is without any crisis. So when you have such a crisis, what's going to happen? And what we saw, what happened, I think they, and correct me if Mahshid, you know better than me, the area called Qasham in Iran, where they basically struck a water desal facility that was supplying 30 villages. And then in retaliation, the Iranian, they tried to do the same in Bahrain. So they struck a water desal facility with little damage. And the question is, when are we going to stop? And how much are we going to expose civilian to such threat? Um, Rebuilding those facility will take forever, and the impact is huge. So I hope that answers your question.
That's very helpful, Hamad. Let's go ahead with your slides, if you don't mind. I think everyone will really appreciate hearing the data that you have put together, kind of depicting what kind of public health emergencies potentially are on the horizon.
Okay, so let me know if you can see the screen. I'm bringing it up and taking it.
Brynn, we were going to go with Hamad's few slides first.
I'm sorry. I thought you meant my slides. My apologies.
No problem. No problem.
Sorry, let me know when you can see my slide. Sorry.
It was up a second ago, Hamad, and then it disappeared, at least on my end. Oh, there we go. Now I see it. Yep.
So I'm gonna go very quick because we have another interesting presentation on this topic. So very briefly, just to give you a flavor of what's happening in the region, there are more than 16 countries being impacted, their health services being disrupted by this event. There is more than 18 million worth of dollars WHO medical supplies frozen today in Dubai hub. Those medical supplies used to go to Africa, to Asia. They are there, and there is an expiry date. What are we going to do, and how can we handle all of this? 20% of the global oil, LNG, energy goes through that area are being halted today. The last figure is scary, but we still don't know the exact magnitude of this crisis. More than 1.4 million people at IPC phase 5. This is a catastrophe coming at that region. This is all during the past 10 days or so. When we look at the infrastructure under siege and what happened, and when we just take two examples, Lebanon and Iran. So more than 43 primary health centers, more than 2 hospitals in Lebanon were shut down during this 10 days. Multiple strikes confirmed. I don't have the figures yet. Even when it comes to medical personnel killed, there is 1 paramedic killed, 6 injured, but again, we don't have the figures. In Iran, we saw 13 verified WHO attack on healthcare. More than 4 personnel killed, 25 injured. Most of Tehran clinics are closed today. In Lebanon, we saw more than 700 today. Yesterday was 800,000 people displaced, and the number is increasing dramatically. They are displaced. In Tehran, I think the figure will be much higher than this, but we have around 100,000 people displaced from Tehran alone. When we talk about the critical funding gap, 86% in Lebanon, 70% in Tehran. Again, $18 million WHO humanitarian health supplies are being frozen today at Dubai. 6 million medicine for Gaza are held, including $1.6 million polio lab supplies. 20% of global air freight capacity idled. So Qatar, Emirates, Etihad, they are all frozen. We saw some movement in the past 4 days, 5 days, but it's nothing in comparison to their full capacity of what they are capable of doing. And the increase shipping cost, more than 45% shipping cost increase for medical goods. And you could just imagine the consequences of this on the cost of drugs globally. Desal, as I mentioned, water security is a big issue there. Bahrain relies 100% on water. Desal, Qatar 99%, Saudi 70%. There are more than 400 desal plants line the Gulf Coast. So the GCC produce 60% of global desal water. Imagine if something happens in that region. You are talking about 60% of the global desal water will be impacted. Iranian drone damaged a desal plant on March 9. And this was first such targeting in the conflict after what happened in Iran. So there was a strike on Qasham Island plant, cut water supply to 30 villages. This never happened before in the conflict. And then Riyadh would have to evacuate within a week if Jubail plant was compromised. Just to give you the sense of the magnitude of this health crisis, if this, God forbid, happens. When we talk about environmental health and toxic air and black rain, those are the type of pollutants that we see from oil facility and fires. And so far, 4 facilities struck around Tehran, and nobody is calculating how much of that is impacting the climate and the environment and the air. We have 9 million residents exposed that we know exposed to such toxic smoke plumes lasting multiple days. And that would need to be evaluated. There are more than 70 miles black salt deposited on vehicles, services, far from the strike sites. And there was a WHO alert, black rain is dangerous for the population, especially RASP. We saw this before. So 700 wells burned 7 months in Kuwait. And long-term cancer studies still ongoing 30 plus years later. And in Lebanon, 2006, we saw a similar incident where basically they bombed fuel storage, released 15 tons of oil into Mediterranean. So when we talk about epidemiological proliferation, more than 18,000 in Yemen, they have exposed to measles cases with 188 deaths. This was back in late 2024. Poliovirus is being again detected in sewage, and meningitis is raising among children less than 5. In the conflict zone, 86%. We are seeing reports that talk about 86% resistant to an antibiotic, third generation cephalosporin in wounded patients. Famine, Sudan, we forgot about Sudan, but Sudan confirmed their famine in July 2024. More than 750,000 were at phase 5. Iran, as I mentioned, the figure will be much higher than this, but this is what we saw in the news in the past few days. Lebanon, more than 700,000 were displaced, 53 villages under evacuation. They are talking about 5 more areas in Sudan projected for famine by mid-2026. And we saw more than 110,000 Afghans returned from Iran since January 2026. Post-conflict health, mental health is a big issue. Nobody's talking about mental health. PTSD, post-trauma syndrome disease. 98% in Lebanon at injury, but then 43% a decade later. And then now we have this big conflict in the region. I'm not going to dwell. The slides will be available for you after the webinar and on our website. But again, post-traumatic syndrome is a huge issue in all of this. What we need to think about as policy analysts, as policymakers, is we need to activate alternative logistics corridors. So God forbid, if a scenario to be happen again, and it might happen again, how can we think about logistics corridors? Saudi has been playing a major role in the past 10 days by supporting all the Gulf countries through the land, medical supplies, transportations, traveling, and Saudi, because it's further than any of the GCC in this conflict, it is safer than all the GCC countries, which is crazy to say. I couldn't imagine saying this in 2026, that Saudi, despite its conflict with the Houthis in the south, today is safest than the other GCC. It has been receiving less missiles than the other GCC countries. We need to think about deploying predictive health intelligence. There are models for multi-regional outbreak prediction. We can use a news-based AI early warning model, and it is documented 46% more accurate than satellite to anticipate famine 12 months ahead. So we can expand this to Iran and Lebanon and see how we can predict famine in the coming year or so. We need to protect water and environmental health. Declare desal infrastructure as protected civilian objects, and deploy rapid water quality monitoring at the Gulf desal intakes. We need to establish air quality surveillance network at Tehran and affected cities. And then lastly is to integrate mental health into primary care from day one. History shows post-traumatic syndrome is the largest long-term burden, and so we need to train our health workforce in handling such situation during such crisis. Long story short, I think the question is not whether the health consequences will persist for decades, but rather it is whether we choose to prepare for them now rather than waiting decades to deal with the consequences. Thank you so much, and sorry for the long presentation.
Thank you so much, Hamad. Just to add two comments before we move on to Brynn Tannehill's talk. So the PTSD from experiencing bombardment is quite real, and I can speak from personal experience. I was born and raised in Iran, and I was in middle school during the Iran-Iraq War. And during those 3 years, we experienced at one point weekly bombings, sometimes multiple times a week. And it's really not an experience that you forget. And it really does have long-lasting, unfortunately, implications. And as far as the water crisis is concerned, as many of you may know, Tehran already had a crisis before the uprising at the end of 2025 and the conflicts that started. And in fact, it was so dire that at one point there was talk of potentially moving the capital from Tehran to a different city. So again, that predates this situation, and kind of as a measure of how potentially dire the situation can get. So with that, I am really pleased to introduce Brynn Tannehill. Brynn graduated from the U.S. Naval Academy with a BS in Computer Science and an MS in Military Operations Research from the Air Force Institute of Technology. Her thesis was on developing a 4-year predictive model to forecast famine, civil war, and adverse regime change in the Middle East and East Africa using longitudinal, econometric, historical, and social data. She did 4 deployments with the Navy, 3 of which were in the Middle East in the 2000s, while flying SH-60B Seahawk helicopters and P-3C Orion maritime patrol aircraft. She served as the long-range plans and policy officer at 5th Fleet, as well as lead campaign analyst from 2005 to 2006. While with the Naval Reserves from 2008 to 2010, Brynn served as an Iran country analyst. From 2015 to 2025, she was a senior technical analyst for the RAND Corporation. Her work there included numerous projects that examined military logistical requirements to support humanitarian and disaster relief operations. So with that, I'm going to turn it over to Brynn. Brynn? Oh, you're on mute.
All right, there we go. Sorry, I jumped in there with my slides there, Hamad. My apologies. Okay, so I'm going to share my screen. Here we go. Bring up my slides. All right. And let me see if I can minimize this. Okay, can everybody see the slides?
Yes.
Okay, great. Okay, so I'm going to be talking about factors in a potential Iranian humanitarian crisis as a result of what's going on right now. I'm sure we've all been following it. I've been following it quite a bit, given that I'm waiting on my work permit in Canada, and my income right now is writing about the war for different outlets. So, okay, SITREP, this number here, over 4,000 targets this morning. Secretary of Defense Hegseth briefed that it's now over 15,000 targets and that they plan on conducting extensive bombing again tonight. One thing that I didn't have time to change because I literally found out about it right as this was starting is that the United States is moving a Marine Expeditionary Unit into the Gulf with just enough people to take Karg Island, in my estimation. So that's another piece of the puzzle. So this is going to keep escalating as it develops. U.S. estimates for how long this was going to take have varied. It started out from a few days or a few more days or very soon to 2 to 3 days to 2 to 3 weeks to 4 weeks to 4 to 6 weeks. When I was writing some stuff up, I also found estimates by Hegseth rather than Trump that said 8 weeks. Right, so this could go on for a while, but we have no idea how long it will go on for. I have an article that's in the works with War on the Rocks that says my expectation is the high end of that. So CENTCOM's asked to be able to facilitate up to 100 days of sustained campaign. 82nd Airborne's changed the training schedule. We've got a Marine Expeditionary Unit with anywhere between 2,500 to 5,000 Marines. moving into the region. So yeah, this is looking like this could extend out. And the reason I bring this up is because every day that this goes on and the more it drags out, the more opportunities there are for something to go catastrophically wrong, for something to go sideways, or for intentional vertical escalation because one side or the other is not getting the results that they want and they feel that they need to change something to be in a better position to get the termination conditions they want. Traffic through the Strait of Hormuz is down 98%. 20% of the world's oil and gas flow through there, along with a lot of other things like sulfur and fertilizer, right? So this isn't just a one commodity issue. This is going to affect a lot of things. U.S. Food growers are predicting that if this doesn't get opened up soon, that we're going to see a price spike in food later in the year, right? Because there's just not going to be fertilizers, going to be a lot harder to come by, right? And part of the mix that makes this so volatile is that the Iranian economy, hydrology, and civil society are all fragile or volatile to begin with, right? Okay, so let's talk just about some of the key factors in Iran. This is not meant to be a deep dive into the situation in Iran. These are just some of the features of the country that I think are most relevant and most likely to produce some sort of triggering event that leads to a humanitarian crisis, right? The Iranian economy at the start of this was not in good shape. It hasn't been for years due to sanctions and embargoes. Inflation is running typically 40 to 50%, but we're seeing as high as 48% month over month for normalized to a per annum. Debt's growing. We're seeing 50% unemployment amongst military-aged males in some regions of the country. We're also seeing widening poverty, wealth inequality, rising Gini coefficient, and one of the key factors that I'm looking at is malnourishment. That's been going up consistently over time, and that's usually a sign that a government is no longer able to provide essential goods and services, right? Especially when you're seeing malnourishment, it's amongst young people. Parents will do anything to see that their kids are fed. And if kids are malnourished, that's a sign that critical infrastructure and capabilities by the government are breaking down. Also, according to counterinsurgency theory and theories about what causes people to rebel or to want to overthrow a government, it's when the governments cannot provide eventual goods and services. And some some studies have suggested that malnourishment is a pretty good indicator of when a government's in danger of getting tossed out or unrest is likely. Moving on to that. We already know that the Iranian government is deeply unpopular. There were likely somewhere between 10 and 30,000 people killed or executed by the regime during the unrest in January, during protests in January. The incoming Khamenei is an even bigger hardliner than his father and is very well embedded with IRGC, the Revolutionary Guard Corps leadership, which is the people that are most likely to kill as many Iranians as needed to maintain control of the government. So that's the potential for civil war as a result of this. Yeah, I'll describe all of this overall in a second. Water crisis. Iran has been building dams since the 80s, and they have not done it smartly. They moved away from more traditional sustainable methods where the water and aquifers were kept underground in qanats, which were drained and have not been used. And they went to above ground dams where evaporation is using up a lot of the fresh water. Another part of the problem is that Iran has wanted to become self-sufficient after decades of embargoes and turmoil. So they decided to try and grow more of their own food, which means more irrigation. They've not been smart about it. They've perversely incentivized wasting water accidentally in a lot of cases. And so they are highly reliant on growing their own food, but growing their own food is using up way too much water, which now they're out of water. Literally, the 5 reservoirs that support the 9 million people in Tehran are at 12% capacity and dropping. They were talking about moving the capital out last year as a result. And this is the Taliban in the east is also cutting off water that would normally flow into Afghanistan for their own dams. So right now, I would describe the water situation in Iran as nearing critical. And if something disturbed it significantly, it could go from critical to deadly. And we already kind of talked about it briefly, but oil revenue is 23% of GDP. 90% of Iranian oil goes through the Strait. 90% of all Iranian oil is also coming out of Karg Island. Right now, this is less of a concern, but it could be, because I'll point something out. Currently, the Strait of Hormuz is closed, except to Iranian traffic. The Iranians are letting their own tankers and freighters get through, particularly tankers. Right now, they're producing about 1.5 million barrels of oil per day, and most of it, somewhere between 1.15 and 1.25 million, is going directly to China. The U.S. has been hesitant to do anything about that because stopping and seizing Chinese flagged oil tankers could cause a problem. The solution to this for the U.S. is to seize Karg Island, which I believe is the next step for the escalation in this war. The U.S. has moved a Marine Expeditionary Unit into the Gulf, which has 2,500 to 5,000 Marines, which is exactly the sort of force that you would need to seize Karg Island to cut off most Iranian oil without bombing it, destroying the capability. And it would go along with previous U.S. efforts to seize oil capacity or be able to use it as hostage leverage, which was done with Venezuela, or to act as a middleman for Venezuelan oil or potential Iranian oil in the future. All of this boils down to is what's known as the oily rag theory, where you have, imagine a room full of oily or gasoline soaked rags, right? And it only takes a spark to light off one of them. And if one of them goes off, it potentially sets all of them on fire, right? So potential triggers for a crisis. So one of them is airstrikes on water and electricity. If the U.S. doesn't think that it can get what it wants out of a bombing campaign that's currently going on and get to terminating conditions it wants, it could potentially target those. That could be deadly, right? And this is kind of the worst case scenario. If the water infrastructure, desalination plants and dams are hit en masse, suddenly you have up to 90 million people that are unable to get water at all. A lot of wells have run dry. The aquifer system is drained. The Qanat system is gone. People living in urban centers don't have access to wells. One of the other big ones is insurgency or civil war. The U.S. is encouraging Kurds to rise up. There's rumors that reports, I should say, that the CIA is funneling arms into Kurdish groups in an effort to potentially spark a civil war. One of the factors in Iran that might encourage civil war or unrest or make it worse is that there is a multitude of ethnicities and grievances and ethnic backgrounds in the country. So you have your Persians, and then you have Arabs, Turkmen, Azerbaijani, Kurds, and then on the eastern side you have some of the more traditional Afghani ethnic groups as well. So there's a map that shows just how broken down it is. This has not been a big issue before. Ethnic tensions have not been a huge factor previously in Iran. It's 90% Shia. but it could potentially if things break down. The US or Iran does have the capability to force or induce the US to vertically escalate the war, potential for assassination, which after the killing of Khamenei, they would regard assassination of a US leader as horizontal escalation. Terrorism, the US bombed a school full of kids. Iran might regard bombing a US school as horizontal escalation if they feel desperate enough. They recognize that this would be seen as a war crime, but it is something they have in their back pocket where they have an excuse of, well, the US did it, we did this as a tit for tat, eye for an eye, right? And also it's possible if somehow they manage to repel an invasion or score a hit on a US carrier, right? That could, and this is unlikely, but it's within the realm of possibility, or score a hit on a US warship and sink it as an escorts a tanker through the strait. It's possible that if the US suffered a major public military setback that's more than just a THAAD radar being hit, it could force the US to stay engaged longer or more intensely, or engage vertically, even if it didn't really want to beforehand. So one thing I would say is that these potentialities for various kinds of humanitarian disaster triggers are not mutually exclusive. They're possibly self-reinforcing. Think of it as the oily rag scenario. If a civil war sets off, it could lead to different groups trying to claim the water for themselves, right? Which then that sets off a water crisis, which then sets off, so like the oily rag theory seems to apply here too, is that if one catches on fire, it could set all the other ones off. Okay. Potentially. So I will emphasize that all of this are hypotheticals and future postulation. None of these are guaranteed to happen. This is just looking at what could go wrong and how badly could it go wrong, which is now where we're at, is how bad could it be? Worst case kinds of scenarios, civil war leading to water crises, or even just a water crisis by itself, would be massive, just because Iran is big. It's a big country with 90 million people. Compare it to Iraq and Afghanistan. It's bigger than both in terms of land area and population, right? And if you compare it with other countries that have produced big humanitarian crises like Syria, 22 million, Ukraine after the Russian invasion of 44 million people, Vietnam had 50 million people, Iraq have 35 million people at the start of the US campaign in 2003. All of these could produce environmental crises, as Hamad mentioned. And one of the other big problems is that it's unclear what state Iranian infrastructure is in, but it's probably not good after decades of embargo. That's what US troops found when we went into Iraq, tried to de-Baathify the country, and we were shocked by how bad electrical and water infrastructure is when US troops looked at it, and we sent in engineers and the Army Corps of Engineers, and they're like, whoa, this is way worse than we ever imagined, right? And that's the potentially where Iranian infrastructure is, if someone were to do an honest assessment of it, rather than just what the government puts out. We talked about the oily rag theory. There's another description of it, is it potentially could be a polycrisis, right? Civil war, death by dehydration, starvation, collapsed infrastructure, lack of medicine, electricity, tropical diseases, all of it happening at once, right? And even if you solve one of them, solving all of you'd have to solve the underlying problems all at once, right? A piecemeal approach is a band-aid at best and completely ineffective at worst. So if one of these big three that I mentioned lights off, right? Civil war, water, in particular, it will be difficult for even a multinational effort to be sufficient to alleviate the crisis that's created. This would have severe economic and political crises that go well beyond just Iran and its neighbors. It would likely spill over into other countries, right? Beyond the Gulf Coast, beyond Kuwait, Iraq, Turkmenistan, Azerbaijan, Afghanistan, Pakistan, etc. Right? Like if Pakistan is destabilized, that's going to have implications with India. And now you're talking about two nuclear armed powers with hundreds of millions or billions of people, right? So that's significant. Another part of the problem that I see is that the U.S. Under Colin Powell, he described why are we staying around in Iraq and doing nation building? Well, we broke it, we bought it. The current U.S. administration has repeatedly emphasized it is not interested in nation building. It's there to achieve destroying Iran's navy, destroying its capability to produce missiles, destroy its capability to support proxy groups that are attacking U.S. and allied assets throughout the region, and to prevent Iran from ever getting a nuclear weapon. Once it feels that it's accomplished that, the intention, I'm not going to say it's going to happen, but the intention seems to be just walk away. Okay, so invasions, embargoes, war have a history of producing refugees and or starvation, right? This is not rocket science, but looking at the scope, after the fall of South Vietnam, we saw approximately 1 million boat people and refugees produced between 75 and 79, a great number of which ended up in Thailand. My aunt is one of them. Iraq in 2003 produced 2 million external, 2.2 million internal refugees, which altogether represents 12% of the population. Turkey absorbed a lot of that, and that was destabilizing. Sudan, we are looking at 17% of the population has been displaced, right? Internally, and 7.5% externally, right? So that's a huge, that we're approaching 25% of the total population of Sudan has been displaced one way or another. Ethiopian famine killed 0.5% of the population, and all of us oldsters remember that one. In North Korea during the 90s, economic embargoes and a government that was unwilling to work with anybody or admit any sort of failure. And sanctions led to anywhere between 2.7 million to 16.7 million, 16.7% of the population died of starvation. One thing I'll also note is that a lot of the numbers I use here and a lot of my methods rely on the best sources I can find, or if the sources disagree, looking at a range presented by what I consider to be credible sources. And a lot of these figures here are drawn from looking at a number of different credible sources. Typically, I like working with World Health Organization, UN, CIA, those sorts of things. So if you start looking at the percentages in the top half of the slide and comparing them with the population of Iran, right? You know, that we could be talking about up to 14 million people dead of starvation and thirst if the dams and desalination plants all suddenly ceased functioning or were destroyed, right? You're looking at 20 plus million external refugees. You could be looking at 24 million internal refugees, which, well, if you have 24 million internal refugees, how are you going to feed them in a country that is struggling to continue to produce food to begin with, right? So all of this is should be staggering if you look at the worst case scenarios above and see just how big that gets compared to what we've seen in the past, which were considered worst case scenarios previously. All right. The only thing that really compares in sheer numbers is what we saw in China during the Cultural Revolution in 58 to 62. So we already kind of talked about this a little bit, but there's numerous causes and factors that we discussed pushing it towards the worst case scenario, right? The factors that make Iran fragile also make it ripe for humanitarian disaster and push it towards the worst case scenarios. The scale and the scope of the disaster has the potential to be something that the world has never intervened in before. And not just that, not only is there a lack of capability, there's a lack of will, right? And I'll discuss the picture on the left in a moment as it relates to that. But the Shia versus Sunni rivalry means that it's going to be difficult to convince a lot of Sunni Muslim countries to intervene. There's also lack of desire to go in from a lot of countries because they just don't like Iran. And as long as Iran's government is holding power in any areas with a hot civil war going on, countries are not going to want to get involved. And if there is a civil war or internal strife going on, or the Iranian government is holding on to significant portions of the country, the civil war is going to be really, really hot, potentially, given that you have one side that's extremely unpopular, that's fighting for its life. If the Iranian government fell, there would be a lot of people looking for payback for all the friends and relatives who were murdered by them in decades of repression. And on the other side, you have people who are religious fanatics, for lack of a better term, who believe that if they lose, they may be put to death, and who believe that their religion says that they need and are authorized to kill as many of their countrymen as necessary to retain control. So a potential civil war in Iran, if it spirals out of control, would be potentially brutal, but a lot of factors are driving it towards that. The US, Russia, and China are probably unwilling to be peacekeepers. We already talked about the US. If you apply the 100-to-1 rule of insurgencies that you need, for every one member of the population, you need one troop on the ground, minimum, even if things are going well. This is like occupying Germany and Japan post-war levels of troop concentration, right? That's still 900,000 people. The U.S. does not have 900,000 troops. The peak U.S. strength in the surge in Iraq was 170,000 troops. So that's not happening. China, again, lack of political will. Also, they may be preparing to invade Taiwan, so they're not going to commit a bulk of their forces when they have other things that they think they would rather be doing with them or going to need them for. Russia is tied down in Ukraine right now, right? Up to 500,000 troops in Ukraine. They're burning through 30 to 50,000 recruits per month in an effort to just swarm Ukraine under, while the U.S. is no longer providing military aid to Ukraine. And that's their calculus. So Russia's not going to contribute anything. The African Union, which has contributed peacekeepers before, it's hard to see them having the logistical or manpower capacity. Pakistan, open question. India's maybe. But what the picture I have on the left is from the Pepcon rocket fuel explosion and fire and explosion from 1988. And this picture was taken by the news crews who were standing on a hill 5 miles away with the firefighters who rapidly said, yeah, this is a foe beyond any of us. We're going to stand back here and whatever happens, happens, right? And I think that's kind of the world's attitude towards a civil war in Iran. No one's going to want to get anywhere near it. likely, probably. Like, all this is probably likely what I expect to happen, but none of it's guaranteed. And I will keep emphasizing that. There's low certainty in any of this because the situation is so massive and fluid and dynamic. So mounting a humanitarian response is going to be incredibly difficult. The situation on the ground is going to be incredibly challenging. The infrastructure is questionable at best. The number of troops that would be needed or the number of people that would be needed are massive. And most likely for this sort of thing to assure security on the ground, you would need troops on the ground. You just can't randomly send in doctors without borders and hope for the best. And the cost and scale would be prohibitive to most countries. We already talked about infrastructure a little bit. We could go in and discover, wow, the runways at these airports have been so badly neglected that we can barely land C-130s here, much less C-17s or C-5s, right? They can't bear the weight, right? Or the fuel quality is so bad that we can't conduct operations out of these airfields. We're going to have to bring in all of our own fuel or reestablish methods to bring fuel, right? The water quality is so bad that we're going to have to set up our own desal plants. We don't know how bad it's going to be when we get there. And that's likely going to up the support requirements for anyone that goes in there, civilian or military, to try and provide humanitarian aid or disaster relief. Insurgency and civil war. If there's a hot civil war insurgency going on, it's going to be incredibly difficult to impossible, both logistically in terms of security and mustering the will to go in by other countries. Iranian government has enough support to make it very, very difficult. And like I said, China, probably not a factor, even if it does have enough troops. India might be there, but getting them to have the will to do something is highly questionable, especially if they think that what's going on in Iran weakens their rival Pakistan. That might induce them to not be so keen on helping Iran out. Don't know. That would be a calculation on the Indian part, and I'm not a subject matter expert there. It's just a postulation. So, big quote here is amateurs talk about tactics and professionals talk about logistics. And I think mustering the global political will to do something is a piece that I'm not as prepared to speak to because that's not my background as much. So that's a necessary condition, but the other necessary condition for providing humanitarian aid and disaster relief is the logistical piece. You're going to have to answer where the money and supply is going to come from. You're going to have to think ahead of time of what supplies are you going to need the most? What's going to be crucial? Who's going to foot the bill for rebuilding their economy? Who is going to be willing to create a Marshall Plan for Iran? If you, at some point in the future, if it does stabilize, right? And if the Iranian government remains in control, but it's a disaster, is anyone going to want to provide money to rebuild to a regime that's hostile and is hit 16 different countries in the region? Knowing what infrastructure is going to need to be rebuilt. And you probably can only do that once you're on the ground and doing engineering assessments, right? If you go in without knowing what your infrastructure looks like, you end up with, or the political system looks like, you end up with a situation like Ethiopia in the 80s, where the grain was rotting on the docks, or in Somalia, right, where you couldn't distribute stuff without it ending up in the hands of factions who were perfectly willing to let everyone else starve to death, as long as their people got theirs. Who's going to provide security forces? How are you going to provide it, right? Who has the engineering and logistical capabilities? Who would be acceptable to any potential Iranian governments, right? Certainly, anyone affiliated with the U.S. and Israel is not going to be particularly popular with the current regime. And whatever regime might emerge afterwards, it's uncertain how they're going to feel about anybody because we don't know what's emerging or would emerge, right? And that's a key consideration. The time to think about these things is now rather than once it's already kicked off, though. There should be people in governments that have an interest or are interested in preventing a humanitarian crisis, particularly people like Turkey and Europe, which would end up having to absorb refugees potentially. And keeping in mind that Syrian refugees were a significant political disruption in the 2010s, they should be thinking about this now and setting up at least a skeleton framework to answer these questions and have people within government and the military at least considering it now and figuring out what are the next steps to be able to respond in an intelligent, somewhat proactive way instead of in a way that is completely uninformed and completely reactive. So where to start planning? Hydrological water infrastructure surveys. Thinking about water right now is something that we can do. There have been surveys done. There are people that have thought about it. There is information. You can see dams from space. You can see water desal plants from space. We know where Iran has sourced these plants from, or the engineering capabilities have come from. In some cases, they have been built commercially from other countries. So you can look at, well, if this desal plant was built by Bechtel or a German company or by Siemens or something, right? And you can say, well, okay, this model, what do they know about it, right? Understand what the logistical points of ingress are available and what their capacity is, what runways haven't been cratered, right? What their load capacity nominally should be. Has this airport been taking airliners that look like 747s? Okay, well, if it can handle a 747, it can handle a C-17. Okay, well, that's something to think about. What are the roads in and out of there like? What does the rail system in and out of ports and airports look like? What does the pipeline system look like, right? What is your plan for going into areas where you're going to have to operate unsupported, where you're going to have to bring in most or all of your own supplies, food, water, fuel, big medicine, big ticket items, right? If entry cannot be achieved or secured, you're like, well, no, just can't be done. Or, hey, we can't service this area at all. There's no way to get to it. Okay, well, if this area produces refugees, what's the most natural flow to them, right? Well, you've got to look at terrain. You've got to look at infrastructure. You've got to look at ethnicity, language, religion. People are going to flow to where they think they are going to be safe, right? That might just be the closest country. Or it could be someplace where they're like, well, this country hates me, but this one doesn't. I'll travel an extra 50 miles to get to a country where people like me are more accepted, right? Turkey looks like it could be one of the primary ones. Pakistan looks like it could be one of the primary ones. Afghanistan, somewhat. So thinking about supporting Turkey or Pakistan would be critical, right? Maybe we can support supporting internal refugees harder. Also, if something happens with water supplies, you got to think about tropical diseases, cholera, dysentery, malaria, big ticket items. Malaria is endemic to southeast Iran. If dams are destroyed and if they're anywhere near full, for some reason, the United States decides that they want to do such a horrible thing because they feel they have to vertically escalate in order to get a terminating condition that they can't live without. Then the flood will come from the first dam, potentially take out the ones downstream, and you end up with a chain reaction, which at the end you end up with cities and locations flooded out. So then you got standing water and flooding of water sanitation systems, which leads to all of these nasty, nasty diseases. The time to build coalitions is now, rather than trying to do it on the fly. If you're trying to build an aircraft while you're falling, that's the least favorable situation. Okay, that's my presentation. I guess we have time for questions.
Yeah, Brynn, thank you so much. That was an extremely informative talk. I so appreciate both you and Hamad. Hamad, if you don't mind coming on camera, we'll do a combined Q&A session for anyone who has any questions from both of you. And if attendees, feel free to just go off of mute or raise your hand, whichever one is more convenient.
Well, I can start. This is Chris here. Great presentations from both of you on horrifying scenarios. Maybe to kind of bring the two together, Hamad, I'd be interested in your thoughts about the capabilities of the Gulf countries to engage in the sort of humanitarian response efforts that Brynn was outlining. Over.
You're muted.
I think they get the question. Did you ask about the humanitarian?
Yes, capability of the Gulf countries to engage in some of the humanitarian activities to meet some of the needs that Brynn was outlining. Over.
So I don't know if so. Today, for example, Qatar sent huge support to the people of Lebanon to build some 3D temporarily housing for them, especially, as I mentioned, there were more than 700,000 people displaced. What happened during this conflict was very controversial when it comes to the relationship between Iran and the Gulf states. For, I would say, especially Qatar. Qatar has been a big advocate for Iran, where we share with them the gas North Field. Qatar and Oman had an important role in the last negotiation with the U.S. To the extent where the foreign minister of Oman came out on CNBC just one day before this war started, saying negotiations are going really well. We are reaching a deal. I hope everyone will commit to the deal. And then this happened suddenly. Knowing what I know about the Gulf states, I think they will be very engaged in any humanitarian aid to the Iranian people during or post the conflict, because they know if Iran succeed, the Gulf states will succeed. If Iran fails, then it will be a big failure. And you have Syria as an example. The Gulf states have been struggling because of the conflict that took place in Syria. Many of the refugees left. Some of them came to the Gulf states. And a similar situation could happen in Iran if things went wrong. What we are seeing now in Syria, because of this change of regime, very positive results. People are going back to Syria. They are trying to building the nation by the people themselves. So long story short, I think the Gulf states are more than happy to support any humanitarian aid, not because they are good people and they think they are good people, because having a successful Iran, a successful Persian Gulf, meaning that it will be prosperous to all the Gulf states.
Thank you, Hamad. We have a question from Beth.
Hi, thank you. This has been very interesting. I'm really glad you did this, and I hope you get wider visibility for it. I wanted to point out that I had a comment and then a question. I wanted to point out that I worked on a study at RAND 20 years ago looking at environmental considerations for contingency operations. And we looked at Iraq. And back then, the water issues are so important. We had survey data. So I'll put in the chat the citation for that. And then more recently, I've done research in the last few years related to climate change issues and how that's made things worse. And I was wondering if there's any acknowledgement in the region or anything that either of you have seen in terms of the environmental issues, not just the water, but agriculture, et cetera, that those have gotten worse because of the climate change, and any concerns? Because obviously with oil, I know there's, that conflict with not wanting to look at climate change issues because of oil concerns and everything, and sort of the political winds. And I was just wondering how that sort of plays out with Qatar and some of the countries in the Middle East. Thank you.
Hamad or Brynn, are either of you, do you have any knowledge about that?
So I would say that health areas are probably not my area of expertise. And so I'd be loath to try and talk about health planning beyond, okay, well, if you sustain this many casualties per day, here's what kind of hospital you need to set up and your roles of care. Hamad?
I say because Qatar has been involved in similar scenarios, different contexts, in Lebanon, and in Gaza to some extent, Sudan, and Libya. I think something could happen there, where basically they rely on local expertise supported financially by Qatar to rebuild those kind of sectors. So the question is whether the Iranian people outside Iran would be willing to come back given the risk, supported by Qatar, to rebuild those kind of sectors. Qatar has been great when it comes to allocating resources, raising fund. They don't have the capacity to do all of this locally by the local workforce. But I think a collaboration between Qatar and some Iranian elites could help to tackle this challenge.
Thank you so much, Hamad. Maggie?
Sorry, my bubbles are all on top of each other, so it's hard for me to see the correct ones for camera and microphone. Really, thank you so much for such an informative presentation. And somewhat along the lines of Beth, Brynn, as you were speaking of the potential for water and food crises, and I hope this is not an area that's difficult for either of you to speak of, but I was really thinking about the population distribution, the displacement, the refugee crisis, and what countries in the area and maybe globally we can anticipate accepting refugees, and whether this maybe should be of equal focus as focusing within the country itself, which is so unstable. Yeah, I'll leave it there.
So one of my big fears is if the how this gets worse, is if people come streaming out and countries are like, we cannot handle this. We are sending divisions of troops to the border with orders to shoot anyone who tries to get across, because we cannot handle this. We are done. This is not our right. We're going to turn people back. And if they try and cross, lethal force is authorized. I'm not saying it's going to happen. That would make things way worse. But I would also say that if Turkey is looking at 10 million people flooding at them, that they might be inclined to do so. Pakistan, same thing. Pakistan is not a rich country. It's going to be difficult for them to come up with the money and resources to support an influx like that, right? That's so that would be kind of a worst case scenario. So does that make sense? It's kind of one of the risks that's out there. Now, if it's a trickle that just keeps going on for years and years and years and years and years, like the boat people coming out of Vietnam, maybe that's more manageable, right? That you could build coalitions to get the people when they arrive, figure out where they're going to go, house them, distribute them, so that it isn't just a wave crashing against a seawall, a tsunami crashing against a seawall, right? Does that make sense? That it's a slow flow that you can divert outwards through other channels to disperse the impact.
Yeah, and I'm just mindful of the fact that, the USAID was so decimated, and that the UN Refugee Division is largely funded by USAID. So this is a really, I think, big problem.
That's an excellent point, that the global capacity to deal with refugees has been gutted by the destruction of US aid and US lack of support for the United Nations.
Just as an informed observer, I can't imagine that any of the European countries would be open to receiving refugees, given how much of a political hot button issue it already is with the last decade of a lot of Syrian refugees and refugees from other parts of Africa and Asia. So so that potentially is one place that they wouldn't be able to go. Any other questions?
I think Turkey could play a major role. Turkey has been really active with the Syrian refugees. They had more than 2.5 Syrian refugees for the past few years now. And given some sense of stability in Syria, I think some of the refugees from Iran could go to Turkey or Pakistan. Iraq is a wealthy country. I don't know if they have the appetite given the conflicts between the Shia and the Sunni there, but definitely Turkey could be.
I mean, okay, there is the Arab Shia population of central eastern Iraq might be amenable to it, and there is a Shia faction within the Iraqi government that might allow for some refugees, but the Kurd and Sunni elements of Iraq probably are not interested. The one thing that concerns me with Turkey is just sheer exhaustion, that they were not happy with the fact that Europe and the rest of the world did not step up the way they wanted them to help them with the refugee crisis from Syria. They absorbed it worse than just about anybody. Maybe Lebanon got it worse per capita, but just in overall volume, Turkey was the primary recipient of refugees. So one concern that I have, because I'm not a Turkey expert. I just know enough to be dangerous. So a concern that I would have is kind of exhaustion, and we're not willing to sign up for, 10 years of Iranian refugees, right? So it's possible that they would put strict limits on it. Or if the flood is too great, they might just say, no, we can't deal with this. So I don't know if you agree, Hamad, but that's kind of my take as potentialities.
I was looking at the visibility of the movement of the refugees, like looking at the map, and I think the potential places Iraq, Turkey to some extent, and Pakistan. I don't think Afghanistan is an option for those refugees to go there. And the question is if the Gulf states will come and allocate budget because they know that they need to contain this crisis before it gets spread to the Gulf states, where could they be accommodated given the physical proximity of those countries to Iran?
I have a question for you, Hamad, though. One is regarding the Gulf Coast states, because I do not know the answer to this, is what is the mood towards Iran right now? Is it basically, okay, you bombed us, forget you, we hate you, you can dig yourself out of this mess? Or is it more charitable, or is it more pragmatic of like, well, if you guys go down, it's going to take all of us with you, which is what you seem to allude to. Yeah.
We don't have any appetite for refugees. The Gulf states are really known to not receiving refugees.
Right. I'm saying this is like for providing financial support to rebuild or support.
Oh, I think they are very open to participate in financial supporting the refugees, as long as they are not part of their ecosystem. Like, we will give you money, we'll make sure that you are stable, because your stability is our stability. But I meant having some of the refugees in the. So I don't know if you know, like, the composition of the Gulf societies. Many of us are Persian. Like, many of the Gulf people are Persian. I would say originally they come from Persia. I would say 40% or 30% of Qatar, more than 50% of Bahrain, 30% of Kuwait, 50% of Emirates are Iranian, who became citizens of the Gulf. Despite that, I don't think there is an appetite by the government of those states to receive refugees rather than supporting them. Today, just as we were speaking today, they shut down the Iranian school in Dubai, the Iranian sport club. They had like a club there. They shut it down, and the Iranian embassy in Dubai, which tells you the mood of this.
We had Superman in the background for a second.
He's trying to save Iran, you know.
It might have been a former colleague of mine who I worked with doing charity work. That's who I think it is.
Chris.
Yeah, sorry, I'm not on camera. It is great to see everybody. So I wanted to drill down on capability. So Brynn, one of the many interesting things about your presentation is just one of the logistical specifics. And so, you mentioned, C-17s and can the runways handle them and things of that nature. A lot of our discussion, though, in the last couple of minutes has been more kind of about the political will and the intent side of things. I wonder, who has the, kind of the airlift capability, the logistic capability to deal with reconstruction. So, I guess I'm shifting from refugees to internal reconstruction. Who has that capability? Is there anybody outside the U.S. military who has, the airlift capability, and to what extent do you think that really is critical?
So the other country that has the absolute capability to mount what is effectively expeditionary infrastructure reconstruction on a massive scale, China. If China is opportunistic enough that if they think that they can get a sweetheart deal on oil in perpetuity by offering Iran, surprisingly low interest loans on stuff, China has engaged in massive infrastructure projects throughout the developing world. Their airlift capability isn't where the U.S. is, but it's significant. And if Iran is controlling the strait and China is sending commercial vessels intended to help boost Iranian infrastructure, I think they get through because the U.S. is not willing to start plastering or blockading Chinese vessels. So honestly, I would look at China as the country most capable of quickly rebuilding Iranian infrastructure.
I would say Turkey as well. Turkey, they are really known to have the capability of building infrastructure. Like, they know how. They've been building our infrastructure in Qatar for the past 15 years. I don't know if there's a political will to do it, though, given the risk.
Yeah, well, I do want, France might be another example. They've done a lot of expeditionary work in Africa, but of course their political will would be questionable given the precarity of their government.
Yeah, I would point at China first as the country that I think has the most will, has the most, doesn't have any particular moral qualms. But the Chinese manufacturing capacity, when you compare it to the United States at this point, is just staggering. Which is, if you put a gun to my head metaphorically and say, okay, who rebuilds Iran? My guess is China, particularly because they already have the deep economic ties through oil.
We have a few minutes left, and there's a question from Andrew.
Yes, thank you so much, Hamad and Brynn, for your presentations and information here. My question is, I'm looking for a little bit of context about the political will of some of the regional players here, particularly Turkey. I'm asking because 3 weeks ago, I heard former Israeli Prime Minister Naftali Bennett say that Turkey is the new Iran. And I'm curious whether that kind of framing is likely to discourage humanitarian aid or the ability to receive refugees, or whether this kind of framing was already baked in. As an American listener, it was the first time I'd heard that kind of framing. Was curious if this was kind of already baked in or is likely to discourage humanitarian refugee relocation efforts. Thank you.
So how should I put it? I think my off-the-cuff assessment is that Israeli politics has taken an interesting turn that reminds me a little bit of the United States. But at the end of the day, Turkey is a member of NATO, right? Israel cannot suddenly start plastering Turkish airfields and cities and infrastructure without it causing a massive problem. So my feeling is Israel may not like Turkey at all currently, may not be happy with them at all, but their ability to do anything about Turkey is significantly limited. And if Iran is solving a refugee problem or humanitarian problem for Europe, and Trump has reasonably good relationship with Erdogan, it's possible Turkey can not extort, but extract money from the United States to deal with the problem, right? Via various assorted means that are appealing to the current U.S. administration. And I won't dive into that because it might seem too partisan, but politically, I don't know where Israel goes with that. And I think that Turkey's ability to say, we will deal with this in ways because you guys aren't willing to, and if you don't, we make the problem becomes worse for everybody. Hamad also mentioned that the Gulf states are probably willing to fund efforts. I don't know that I see Israeli unhappiness with Turkey playing a major role in this, because as unhappy as Israel is, at the end of the day, they can be beyond furious at Turkey and they still probably can't do extraordinarily bad things to Turkey and get away with it, or without causing a crisis that gets even bigger. Because now, okay, it's, Turkey's invoking NATO Article 5, right, legitimately, and oh boy, that's just so I don't think Israel's willing to go to that level. And if they're not willing to bomb Turkey, well, how much can they do to Turkey? Because they don't like the fact that Turkey is supporting Iranian refugees or something, right?
Given whatever happened in the past 10 days with the Strait of Hormuz and how Iran was able to lock down the region, everyone will jump on this. I think this is strategically, knowing how important this area and how one country as Iran was able to lock down the Strait of Hormuz, I think they will jump on it. From the Arab countries, I think Qatar is a small player in this region. Iran has been our ally for the past 30, 40 years, protected Qatar actually from some of the neighboring countries during the blockade that happened by 4 different countries in 2017. I think Qatar, just a second. Qatar and Oman see it as a strategic void that they want to fill. If you see how Saudi reacted towards Syria after the new administration came on board, they supported Al-Shara 100%, which was really shocking to me. And for them, you know what, this is a strategic void. Can we fill it rather than saying we don't want anything to do with it? So this is my 2 cents on this.
Great. Thank you very much, both of you.
So we're at the end of the webinar. Thanks everyone for joining. A big thank you to both of the speakers today. We did record the session, and we will be including the link to the recording both on the APR website and on LinkedIn. I do want to impress on everyone that many of the analyses that we talked about today, particularly predictive analyses, to anticipate some of the potential risks that can lead to humanitarian crises. These are the type of analyses that APR has the capability of doing. So if you or your organization has an interest in this, please reach out. And I have the contact information for APR for any questions or inquiries in the chat right now. Thanks again, and have a wonderful rest of your day.
Thank you.